Hello, and welcome to our weekly ICT4D conference podcast. My name is Sonja Ritzel from CRS, and I'm interviewing experts for you to talk about digital development trends, innovations, and good practice. Today it's my pleasure to talk to Bobby Jefferson at DAI Global. Bobby, would you like to introduce yourself to our audience?
Yes, thank you, Sonja. So I'm Bobby Jefferson, Chief Technology Officer for DAI Global Health. And my background is digital health technology, supply chain, and lab information systems around digital health.
And as part of a podcast series, I'm speaking to CIOs and CTOs about digital transformation. So, Bobby, I would like to hear from you your insights on digital transformation in health, particularly how it has been impacted through the COVID pandemic. And I understand you have done some work in digital and cyber secure connections for staff, employees, and connecting to other resources. Would you like to tell us a little bit more about that?
Yes, I'd be happy to. So the digital transformation that has occurred due to COVID has been very dramatic this year. We've seen a lot of attention paid to remote working, staff working remotely, employees, consultants in the field. And I currently have a Haiti project that's supporting COVID, and many of them are also working remotely. So this has been a sincere transformation led by digital and due to the impact of COVID. And so as people and organizations, international development organizations and NGOs and small civil society organizations all go to work from home or digital remote learning and working, attention needs to be paid to making sure that they're cyber secure. Recently, the WHO website was hacked and the emails coming from the WHO were not trusted. We've seen emphasis on trying to penetrate healthcare clinics and hospitals, especially those working on the COVID vaccine. And so there's just this increase in the focus by hackers and others on healthcare and clinic systems. So we have been working on cybersecurity for healthcare to help secure not just our staff and employees, but our really important patient and privacy information that's connected to the hospitals and to the clinic.
Thank you. What other trends are you seeing with regards to digital transformation in the health sector? Obviously, cybersecurity is important, but I assume we also see an intake of emerging technologies and with a higher focus on digital technologies these days.
Yes, that's correct. So we're seeing the uptake in telemedicine. So where many people are having virtual appointments with their pediatrician, with the general practitioner, with the doctors. And so this is a great way to at least have a patient clinic interaction using the internet and the mobile phone. And then this other big trend is the Uberization. I call it the Uberization of healthcare. And what that means is where instead of going to the pharmacy to stand in line, instead of going to the clinic to have your blood test or even a COVID test, now, a lot of those services are coming to you that you can order at home or you can deliver to you pharmacy meds, and you can use your mobile phone to do your own vital signs and pulse oximeters. So this advent, because of COVID and the transformation, allows opportunities where your healthcare can be in your hands and in your family's hands and at home. So for medical diagnostics, for doing just, your own COVID tests at home. And importantly, there's now solid regulation that allows this to happen, both by the EU and by the FDA.
Excellent. Do we see those trends globally as well? I mean, do we see an uptake also on telemedicine on other continents?
Yes, we are seeing tremendous use of telemedicine, for example, in like Indonesia, which has 300 million people and 25,000 islands and very decentralized. And in order to get to a clinic or a hospital, you have to walk and potentially take a boat as well. So we're seeing huge uptakes, especially in Southeast Asia, Cambodia, where there's a lot of flooding that's happening now today. They have a floating hospital, a floating clinic, and that goes down and meets all the different patients on the water, on the river. And so in order to provide telemedicine services. So we're seeing a huge uptake in being able to provide services, bring services to people, and to deliver those. But these services are also under the regulation of what US FDA calls the 510K. So, many people are familiar with the FDA. They help regulate, drugs, medicine, and now they've achieved that you can have your software, your mobile phone, and your algorithm, all three together, that can be submitted for FDA approval as a medical device. So what that means is, especially if you're working in Africa, you're working in Zambia, Kenya, and you've got a great solution that, you do mobile phone screening for women or mobile phone screening for children in a clinic or a hospital. The phone, the solution, and now the AI algorithm all together can be an approved medical device, just like, other medical and laboratory devices. So this is a tremendous opportunity for those who are working in Southeast Asia, for Africa. I'm helping to support in Kenya, these companies that have these devices, because now this also opens up the US market and the EU market as well. So, the COVID has given opportunities now that weren't there before. So I'm very excited about this transformation where innovation is coming from Africa, from the global South, potentially into the US and potentially into the EU as well. That opportunity is now there.
Oh, that's excellent. That's a huge step, having medical devices being so inclusive now. You mentioned AI as a medical device. So we also see very much an increase of AI and machine learning and automation of services, from chatbots to, I guess, more sophisticated AI solutions. And is that something you also like to comment on?
Yes. So thank you for that. So definitely a supporter of, using artificial intelligence, machine learning as solutions, for example, for searching for breast cancer patients, cervical cancer patients, for, retinal scans, searching images and being able to detect and provide recommendations around diagnosis. So I think that's a strong use case. But I'm also, very conscious around the bias that both ML and AI have, that they're only good as the algorithms and the people and the test. So, there's the use case of often people using AI to do, for example, job matching, right? So a lot of CVs are coming in and people put CVs, of course, in different formats. And now you want to make sure they match people with jobs. So there've been a number of AI tools that have learned to only match women into gender-specific jobs. It was because that's how the machine was learning in the beginning. And so there's this definite bias that I'm trying to highlight. And there's a number of studies also around the different types of facial recognition based on skin color and false positives. So I'm very much, a proponent or advocate that the AI and the ML tool needs to be transparent. Right now, it's a black box. It makes decisions, whether or not recognition around a cancer polyp, or it makes recognition around who you are in terms of your face. But we don't have insight into that black box of why it made that decision or what kind of test case did it use. So I'm being very, much an advocate of trying to have much more transparency and not just allow the doctors, the clinicians, the patients to hand over completely the clinical diagnostics to the AI. There still needs to be a human intervention, or at least some test case that shows that it's not biased. Because today there is bias, both gender and racial bias, that's introduced to a number of the AI and ML systems. Part of it is because they have a limited data set, right? That if you use the data set from the UK or from the EU or from the US, for longitudinal records, whereas, I try to help them to have access to, patient data who are undergoing cancer treatments from Zambia or from Kenya. So they can have a rich variety and diversity of data sets. So that way they now can demonstrate and show that their algorithm actually works. But so right now there's a number of initiatives that are ongoing around that. Within DAI, we've given webinars, we've given articles on LinkedIn. So we're continuing to push this envelope around transparency, openness, and reducing bias in AI and ML tools.
Thank you. Yes, as you said, AI is, or any technology is really just as good as the people using it, and also in this case, the data we're feeding to it.
If I can give a shout out, a huge plus to Sonia and the CRS team, it was 3 years ago in Zambia, where actually at the ICT for D CRS conference, one of the plenary sessions was on the bias of AI tools. And so, you actually have been ahead, 2 or 3 years ahead of where we are today. So I just want to thank you for that as well.
Thank you so much. That's really kind. So my last question for you, Bobby, is around the digital strategy. As we said, obviously the technologies are there, and we're seeing now a bigger use of those technologies also in the NGO and international development community. But how do you see that influencing our digital strategies or our priorities? What do you see as trends, either with your partners organizations or within DAI Global?
Great, thank you. So USAID has published its digital strategy. DFID, which FCDO, has also published its digital strategy. So those who are implementing partners or working with donors, even Global Fund and others, they have everyone, WHO, each of them are embracing digital and digital transformation. So what's needed then, and not just in health, across agriculture, education, and as you heard from the other podcasts as well. So the question then becomes, how do you then make decisions, strategic decisions, around investments in digital? If you're an NGO or you're a partner community, who is that person within the organization? And so what I try to help mentor some of the groups is to think about having a chief technology officer or digital officer at the executive level within the organization. So, and what that will then help you think about is not just what your digital strategy is, but how to retain staff, how to have a career for digital individuals, how to apply digital internally, whether or not you're working on grants, whether or not you're managing staff, just doing simple things like signing documents together, electronically. And then of the outward facing one, how are you helping patients and community and frontline health workers as well? So, for me, it's hugely important for many NGO groups and national development community to really have within the group at the executive level, not just at the project level, executive level, a person who's thinking about your digital strategy, and because COVID isn't going away tomorrow or next week. And as we said, this digital COVID has helped accelerate the digital transformation. So now having both the CEO and the chief technology officer and the board really think through a strategy for what does that mean for the next 2 to 3 years is hugely important. It can make a huge difference for those organizations to survive and thrive as we go forward.
Thank you. That's an excellent point. Definitely for the digital team, not just to provide services, but assist with the decision making and the strategy and also the innovations going forward. I like it. It's a point we've been making in the tech sector, at least at conferences for over a decade, to put the CIOs and CTOs on the board. And I'm hoping that the current general transformation might support this. I wanted to have a follow-up question with you and see, what do you think the future might hold?
So I think the future holds promise for using the skills that we have in country. So what we've learned is I don't need to come to the office in order to have a meeting or make a decision. That I can, use the staff I have in the country, whether or not it's Nigeria or Rwanda or Kenya. I can use their brain power because I'm connected digitally. That I can leverage people in Indonesia and Afghanistan and have them part of the process because, we're all working from home. And that now has an opportunity to give voice and allow them to also be at the table. So I think this emphasis on using our local staff and our communities, local community much more, I think is something that is a promise as well. other part to that, though, is security. So as we get more people connected, there's more opportunities for hackers and others. So at the same time, the cybersecurity part from end to end needs to be built in, protect the patients, protect the clinics, to protect the staff, and to have these healthy behaviors. So that way we can, work together, we can share information, but we can do it in a safe and secure environment. Because there are many, many hackers and others that are always trying to get into our systems, disrupt, or even just simply hold clinics and hospitals from ransomware. So I think that there's going to be a dual edge of the promise and the protection as well.
Thank you. Yes, yeah, I love how we're circling back to the importance of the information security, which was your first point. Thank you so much for sharing your insights.
Oh, thank you. I really enjoyed this. I appreciate it, the opportunity to share a few things. Thank you.